long COVID sufferers are soon to be recognised by the NHS and offered care. Those suffering with so-called long COVID have reported breathlessness, chronic fatigue, brain fog and other complications including issues with the heart, lungs, kidneys and musculoskeletal problems months after initially falling ill with the virus. Some suffering from persistent symptoms did not fall badly ill with the virus at any point or need hospitalization, but have remained poorly for months. Now the National Institute for Health and Care Excellence, NICE, and the Scottish Intercollegiate Guidelines Network, SIGN, have said that new guidance is being drawn up to help guide the care for people who suffer long-term complications. The health bodies will work with the Royal College of GPs to draw up the guidelines, which will be published later this year. They said that there could be as many as 60,000 people in the UK who probably have long COVID. Claire Hastie, founder of the Long COVID Support Group which has more than 24,000 followers on Facebook, welcomed the move, but told the PAR news agency that it was vital that patients were involved in the creation of the guidelines. Ms. Hastie, who has lived with long COVID for many months, said, "The guidelines cannot come soon enough. Too many of our members continue to be told by their GPs that their symptoms are caused by anxiety, yet research has confirmed that even those with mild initial symptoms can sustain organ damage. Many of our members are bedridden or housebound for months, and many are unable to work. Early intervention may well have led to very different outcomes." She said that COVID clinics should be set up around the country to help people suffering months after catching the disease. People of all ages have been known to suffer from long COVID. Charlie Mountford-Hill said 2 of her children came down with coronavirus in March, although the other 3 appeared to avoid it. However, around a month later all of them started exhibiting long COVID symptoms, including skin rashes, COVID toe and diarrhea. Her youngest daughter, who was hospitalized twice, was in such pain she begged, "When will my tummy stop hurting?" every morning. Paul Crisp, director of the Centre for Guidelines at NICE, said, "There is growing evidence to suggest COVID-19 is a multi-system disease that for many people involves persistent symptoms with longer-term impacts on their health. It is important, therefore, that people requiring ongoing support and treatment are identified quickly and are supported by the NHS throughout every stage of their journey. We also want to ensure that clinicians have clear guidance on how best to support patients struggling with this newly emerging disease." It comes after a leading academic warned that the effects of long COVID could turn out to be a bigger public health problem than excess deaths. A report from the Tony Blair Institute for Global Change is recommending that the government highlight the issue in awareness campaigns. In the report's foreword, Tim Spector, Professor of Genetic Epidemiology at King's College London, said that in the first few months of the pandemic little attention was paid to the infected population who were not sick enough to go to hospital, who made up 99% of cases. He said it turned out that COVID-19 was not just a bad flu, but in many people it behaved more like an autoimmune disease, affecting multiple systems in the body. Prof Spector said the app launched in March by his group at King's College London, and the health science companies ought to capture the wider range of symptoms people were experiencing received data from more than 4 million people. Researchers learned that a great many people didn't get better after 2 weeks as expected, Prof. Spector said. He added, "We kept following them and found out that a significant number still had problems after months." This is the other side of COVID. The long haulers, that could turn out to be a bigger public health problem than excess deaths from COVID-19, which mainly affect the susceptible elderly. The report said long COVID seems rarer in those under 18 and over 65, with higher prevalence among those of working age. The median age of those affected is 45, and it affects women more than men.